What is the cholesterol level that we should target? Different kinds of cholesterol, good cholesterol, bad cholesterol. So good cholesterol, we call it as HDL. How I remember is H is healthy, health HDL. LDL, L is lethal. So that is a bad cholesterol.
Yeah.
So what should be the target for an LDL cholesterol?
Yeah, so LDL is the bad cholesterol. As you said, so that is a good mnemonic for layman to remember. L for lethal, as you said. So LDL cholesterol, as per recommendation for Indians, it should be less than 100 for
Is it
everyone.
100?
100 milligram per deciliter. So for everyone. And depending on the risk factors, number of risk factors they have, whether they have only hypertension or diabetes, and then it can be reduced even to less than 70 milligram. And they have a cardiac problem. The recommendation is that heart problem, heart attack, or stroke, or a lower limb artery blockage, then it should be brought less than 55.
Less than 55.
55. And even if they have multiple risk factors, and then are they recurrently developing, repeatedly developing problem, like now cardiac problem, then after 6 months or 1 year they're developing stroke or lower limb problem, you can even bring it to less than 40 also.
So HDL and LDL should be the same.
No. So yeah, see, the lower the LDL, the better,
The better it is,
I mean, the lower the LDL, the lower the risk, and better is for cardiovascular
Because
health.
HDL high is like 40 plus.
Yes.
Or 45, 50.
45 plus.
So basically high HDL and low LDL. So in WHO, I mean in the US, the cutoff is 130, 130. But for Indian people, it is much lower than that.
No, so Indian and European recommendations are also like that. So especially for India, because we see a lot of people developing cardiovascular problem, and then this less than 55 for people who have developed heart attack, that is recommended by even everywhere throughout the world. So even American guidelines, everybody recommend that less than 55 is a level that should be LDL should be brought on to that level less than 55 when they develop a heart problem, heart attack or stroke kind of thing.
What is the average LDL number that you see in your practice?
So it's many times it's 100 plus what we see for many people. Like now it's somewhere between 100 and 110 or 120, 130 what we see commonly. But there are people who come with even higher levels, 200 or something like that.
In my practice, I see usually 150 to 170.
Yeah, so I would say 110, 120, 130 is common what we see. Because people who come at a younger age in health checkup, most of them that is the value.
I see.
For some people it is higher also.
I see. But for the upper limit, it will be 130 in the report.
No, so that they have not changed. The report what they are giving, India, that is wrong actually. So optimal level recommendations less than 100. So labs have not changed that what they're giving this recommended level, that recommendation what they given, that is wrong actually. They have not changed that.
So the reports will say normal.
Yeah.
But it may not be normal.
Yeah. We have a Lipid Association of India, which is very strict in controlling the LDL level. They give us stricter guidelines because more and more of Indians are developing heart disease and then succumbing into cardiovascular disease.
So what is the ideal age of testing cholesterol levels?
So the ideal age for testing cholesterol level is around 18 years, 18 to 20. That is college going year. So when somebody completes schooling and enters college life, that time LDL has to be tested, cholesterol level. And after that, every 5 years, if it is normal or if it is going to be abnormal, then doctor will prescribe you to test LDL. But most of the time in India, the blood cholesterol level is tested around 40, 50 years of age, or when they develop a problem. Okay, so that is very delayed. Level of testing, that time of testing the LDL level. So the earlier it is tested, and it's not like they have to start medicines. Then at least they can undergo lifestyle modification.
Yeah.
It's going to be that is going to be an impetus. The factor is going to influence them to change the lifestyle modification.
Should they repeat once a year or once every 3 years or once every 5 years?
No, so like if they test around 18 years of age, if it is normal, once every 5 years should be sufficient.
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 Yeah. Technically, if everything is normal, you don't have to check every year.
Yeah. Okay. You need not check every year.
Super. So we talked about LDL.
Yes,
so
sir.
we are accepting the fact that it should be less than 100. How about HDL? HDL is a healthy cholesterol. So we need to increase it. And I have studied that physical activity is the only way to increase HDL. Is that still holds true?
Yeah, physical activity increases. Generally for Asian population, Indian HDL level is going to be low. Various studies have shown that medications which aimed at increasing HDL level didn't contribute to reducing cardiovascular outcomes when reducing cardiovascular disease. That's why the target is LDL, where we try to reduce the bad cholesterol. So you can be a good person with multiple qualities. If you have one bad quality, you are supposed to be cutting down that. So that's what something like an analogy I have to give.
So even in LDL, nowadays there is an even more subfractionated segment. It's called LDL little a.
Yeah.
Lipoprotein little a. What is that?
So these are called extended cholesterol tests. So where when usually we prescribe them for people coming at an younger age with heart attack or a cardiovascular problem, we advise them to undergo lipoprotein A, so LP small a within brackets, and even small dense LDL test also we advise. There is something called homocysteine level also we do, and apolipoprotein B. These are the tests we do. Lipoprotein A, that is small a, is an emerging cardiovascular risk factor, and the higher the level, it's going to lead to cardiovascular blood vessel blockage, and also it's going to lead to calcification of valves and coronary arteries.
Okay.
And this what we commonly do test is LDL level, but the actual subtraction of LDL, that is small dense LDL, is not tested by many labs, or it's not available in many hospitals also
see.
in Chennai or India also. People are not aware, or people are not concentrating on that. I would like to say that insist on testing small dense LDL fraction, because that subtraction of LDL, that is small dense LDL, is going to increase the risk of developing cardiovascular problem.
So have you seen patients where LDL is normal, but lipoprotein little a is elevated?
Yes. So people when say that no, my BP is normal, sugar is normal, even LDL is normal, then we ask them to test lipoprotein small a. That may be elevated, and even small dense LDL subtraction may be elevated. So when we go for testing further, then we come to know about these risk factors, hidden risk factors, and then we have to treat them.
How about triglycerides?
Triglycerides, definitely in India, diabetes is more, and because of the high blood sugar, and then this can easily get converted into cholesterol subtraction, that is triglyceride. And this elevated triglyceride, low HDL, good cholesterol, and elevated small dense LDL forms a triad. It's called atherogenic triad. That means this combination can lead to cardiovascular blood vessel blockage problem. So an increased triglyceride can get deposited in the liver also, fatty liver. So that can happen because of that also.
So what is the number the triglyceride should be less?
So triglyceride should be less than 150 milligram per deciliter.
Do you focus on total cholesterol number at all?
No. So frankly speaking, nowadays we don't see, cardiologists at least don't focus on total cholesterol level. We first maybe look at LDL. Then we go for non-HDL. That is total cholesterol minus good cholesterol, HDL. So non-HDL level. Then we concentrate on this triglyceride level. Then comes this extended cholesterol.
Extended cholesterol, lipoprotein little a, and
A,
everything.
apolipoprotein B, and other things.
Super, super.